a Black woman that had cancer, and advocating for myself looked like changing doctors, saying I'm not doing this without anesthesia, meaning like whatever I was not comfortable with, I was not doing. But also like my care included my village of who was my caregivers. Had to also advocate for myself in those capacities too, because I had to tell them, I can't handle this part, can you handle this? So like for my care and just for my journey, I still advocate for myself. I still have to push for those same type of things I was going through during cancer, post-cancer, because now I'm in menopause at 31. And so like now things look a little bit differently for me. So now I have to advocate for like, okay, I need medication for my hot flashes and my fatigue, and to get my estrogen right, I have to do this, or I have to see this specialist. And so advocating for myself and my care, it really stems from me just being Black sometimes and having to like, not wanting to be the aggressive Black woman, but wanting to make sure that my voice is heard and also that my needs are being taken care of.
I had to speak up and always ask for help. I feel like it's important if that you don't know something or that you have concerns with something, you let somebody know so they could explain to you and communicate with you better to understand what is going on.
When I was first experiencing cancer symptoms, I went to 4 different doctors, all of whom told me I was just experiencing anxiety. But I knew that my shortness of breath, my back pain, my chest pain, all weren't normal. So I finally went to the ER and they confirmed that I had an 11 centimeter mass in my chest. Later, when a treatment plan was recommended for me, I advocated for myself by seeking out a second medical opinion by one of the top lymphoma specialists in the country. Then, during my treatment, I was having a really hard time with chemo side effects. My cancer survivor friends were the ones who reminded me to advocate for myself and ask for more help so that I could feel more comfortable. This eventually led to a much better combination of medications that made me less nauseous and much more comfortable when getting my chemo treatments.
With me, it started with a really small lump by my collarbone, very tiny. One day I was just putting lotion on and it felt different. I went to the doctor. I was told that everything was okay because I had no other symptoms whatsoever. So I went home, waited about a couple weeks, saw that the lump was still there, went back in. This time the doctor said, okay, well, let's take a fine needle biopsy. So they did that, and then they found the cancerous cells. But if I wouldn't have listened the first time, and I would have just went home like I did and just continued, months would have gone, and it makes me wonder what would have happened.
Our son was so busy trying to wrap his head around his diagnosis and everything that meant that he really didn't have time or the strength to be his own advocate at that point. And so I stepped in and said, how can I help you? What do you need? What do you want from me? Over the course of time, he is now in maintenance, thank goodness. And so he's doing a lot of his own advocacy. He's asking some really good questions. My advice is to get out there and ask my son, what do you need? And when he says, I don't know, then I just kind of went into mom mode and did what I knew needed to be done, but checked in with him regularly to make sure that he was still okay with me doing that.
I've advocated for myself by letting people know what my top priorities are and ensuring that those priorities are respected. In healthcare settings and in general, my top priority is my health. So of course this should be shared by my healthcare providers, which means that above all else, they should be focused on supporting my health. In my experience, I definitely recommend getting a second opinion about what treatment is best for you. Of course, treatments for different types of cancer vary, but in my case, I was diagnosed with lymphoma at the age of 25 and was started on a regimen for treatment that I later learned probably wasn't the best regimen for me. A few months in, I had a consultation with another doctor who suggested that I consider another treatment regimen, which in this case was a treatment mostly used for pediatric patients and also for many adolescent and young adult patients. I ultimately changed my treatment to this other regimen as the treatment outcomes were evidenced to be better.
When I was in active treatment, I was an undergraduate student, which meant I was receiving health insurance from my university. And so that was the insurance that covered most of my care during active treatment. However, I graduated later that year, and eventually I no longer could keep that insurance, but I still had my mother's health insurance. However, it was considered out of network. So I had to submit a waiver to the insurance to ask to continue my care with the oncologist that I had been seeing. And the reason I did this is because of how rare the cancer I had is. And actually, when I had my surgery, which was at a whole other hospital, the oncologist there had even told me, I can treat you, but I'm not familiar with this cancer or the treatment, and I don't feel like I'll be the best option for you, which is why I want you to see this other oncologist. So I had to explain this in the request to the insurance, but they actually denied me. And eventually it was finally approved, and I have been able to continue to follow up with the same oncologist since then.
My journey started in 2023 from me discovering a cyst. And that cyst prompted me to have to advocate for myself even more, because it would go away and come back, go away and come back. And at that moment, I was just over it. I think for me, that was the start of my advocacy journey. And me just having to advocate for myself, because it does not run in my family, number one. And number two, a lot of doctors did not want to push for me to have a mammogram or even to have an ultrasound to see what was going on with it. My cyst was on my left breast and my cancer was also on my left breast, but they were on two totally opposite different sides. And I figured that if I did not have the cyst, I would have never known that I had breast cancer and that I was getting ready to embrace or embark on such a meaningful, powerful journey in my life.
I've had to make phone calls for my wife, talk to her physicians, talk to her, to grant managers and outside organizations, and do whatever I have to, and sit through appointments and ask questions for her that she may not have thought of or may not be able to think of.
When I first started my treatment, I was, given pills, and they were messing up with all of my biochemistry inside. They were messing up how I felt. And I had to have tough conversations with my parents. I had to have tough conversations with my siblings, with my friends, saying, this has absolutely nothing to do with you, of how I'm showing up. I'll show up angry, I'll show up super elated, and I'll show up sad, and I'll show up with a lot of energy, I'll show up depressed. And I had to have tough conversations with the people that I love that, listen, you've got to give me my space, because this is all new to me, this is different, and I want to be there, but it has nothing to do with you. My circle does not know my experience. They do not get it. And so I sought out a community of other cancer survivors that get it. And I was on a trek with True North Treks last September, and I met incredible people. These are people that I'm going to have for friends for life. When we were able to connect on such a spiritual and grounded level from that standpoint, organically our cancer stories are going to bubble up. Our cancer stories are just going to come out freely. Oh yeah, in my cancer journey, this is what was happening. Oh yeah, you too? Like, oh, my cancer journey was like this. Myself advocating for myself was, okay, I can't hold my family and my friends responsible for my healing journey. So let me go out and find a community that gets it. So when I do talk about these things, it's not taboo. It's not someone looking to say, oh, I'm so sorry that you've had to go through this. Or wow, you're so brave, you're a warrior. No, I want to have these conversations open and freely and vulnerably with other people that get it.